London, home to over 8 million people. When someone gets seriously hurt, it's down to the trauma doctors to investigate.
She's hit the headlights. I think it's probably going to be with the right side of her pelvis.
To save lives, they must look for clues.
The helmet is damaged. That worries us about the impact to the head.
The trauma doctors have to assess the evidence within minutes.
So there's a dent here, but as to which bit of him hit that is not entirely clear, but quite possibly his head.
And unravel the medical mysteries.
There are a myriad of things that can cause all of those symptoms.
That police was asking me if this is still life-threatening, which it is.
In their search for answers, getting it right can mean the difference between life or death. As night falls over London, an elite squad of trauma doctors hits the road, taking their expertise out of the emergency department and onto the street. As they battle the traffic, it's a race against time to get to the patient. The quicker they get to them, the more lives they can save. Racing to a road traffic accident is trauma doctor Gareth Greer.
We're going to a motorcyclist who's been hit off their bike somewhere.
With accidents involving motorbikes, the trauma investigators will be looking for clues amongst the wreckage. Any damage to the helmet could be a sign of head injury. The distance of the body from the bike gives them a clue about the force of impact.
Red Base Delta Alpha 77 on scene.
Gareth now has just minutes to look for these and other clues. Every second could prove vital for the biker.
So where's your pain, sir?
In the leg.
All in the right leg?
Yeah.
How does your breathing feel?
Good.
So you remember exactly what happened?
I turned left of the lights.
You turn left of the lights? Yeah.
Oh, my leg.
Okay.
44-year-old Brian is a courier. He was on a job when the accident happened.
Do you think you hit your leg on something? Don't know. All right, I'll stop the questions and we'll get you out of pain, all right?
He's breathing away normally and talking to me, which is reassuring. He's in a lot of pain and the gas is helping him at the moment. This leg is really worrying me. The foot is very, very pale. I need to get this blood supply back.
I think our overall plan is some access, some ketamine and some splinting, but I'll work it through in a minute.
Yeah.
Do you have any other medical problems at all? No. All right, we get a drip in, strong painkillers, straighten this leg. That'll get you out of pain, sir, right? We'll get you out of pain completely. So as soon as this drip goes in, I'm going to give you something that's going to make you feel really sleepy. Okay, you won't feel anything then.
Okay.
You'll probably wake up a bit in the hospital. Okay, but you won't mind that, yeah?
No.
Okay, all right. That shoulder sore there.
Yeah.
Yeah, I thought so. Well done.
That's the needle.
That's a perfect drip. I'm going to put a sedation in and then we'll be all sorted. And that'll take less than a minute to work, okay? Just rest yourself gently back. Just go back with your head. That's it. Well done. And just rest your head on the bike. That's it.
Now Brian's pain is under control, Gareth can check the scene for any clues that could point to other injuries.
Sometimes if the helmet is damaged, then that worries us about the impact to the head, but there's no damage to this helmet, so that's reassuring for me. This is a difficult one to work out. When the ambulance crew got there, he was underneath the bike, and so the position he's in now doesn't really represent the position he was in before, because I think that right leg, the leg that's injured, must have hit this telephone box. That's brilliant, the sedation's working.
There are no signs of any other injuries. Now Gareth needs to concentrate on saving his leg.
There we are.
Brian's livelihood could depend on it.
Okay, so we'll just give it a nice little pull there. It'll crunch quite a bit, but you can't do any damage.
Yeah.
Do you mind just staying at the top end and just talking to him gently?
Yep.
Just so when he comes round he's not too frightened, because he won't remember anything that happened.
This gentleman's GCS 15, but with a compound fracture to the right femur, which we've just manipulated. We're going to ground escort to the Royal London. Fairly pale, that foot, isn't it? I'm going to have a good look in the ambulance. Yeah, that's cool. The bottom of the leg here is quite vulnerable when you get an injury because the big artery called the femoral artery comes down the inside of the leg, and so if the bone around that breaks, then it can put that artery under a lot of pressure. The longer the blood supply to a limb is interrupted for, the more severe the injury to that limb is. So getting there and getting the blood supply restored to a limb like this is extremely important. The foot has started bleeding a bit, which does suggest that the blood supply is getting there, so that might be a good sign. But his foot still looks fairly white.
Brian is being taken to the Royal London Hospital in the heart of the East End. It's one of the world's leading trauma centres, and its emergency department treats up to 500 patients a day.
Okay, and they're going to be here pretty much any minute, probably.
So this gentleman's name is Brian. He came off his motorbike at a corner and hit his leg on a telephone box. When we got there, he was sitting up and talking GCS 15, no signs of any head injury, just pain in his right shoulder. But his major injury is a deformed and angulated right femur, which we've manipulated on scene. He had a cold, avascular right foot at the time, and the blood supply seems to have come back to that foot post-manipulation.
Okay.
Numbers-wise, he's been normal. He looks euvolemic. He's had a GCS of 15, but he's had 150 milligrams of ketamine, which he's now coming round for. He's had a total of 8 milligrams of morphine as well.
Okay, thanks very much.
It's now down to Simon to carry on the investigation.
We're going to take the scoop out from the right with counter traction. It's just well...
Ready, brace, hold.
Okay, let's crack on with the primary survey. There's a serious injury to his leg. It's pale. The blood flow is a concern, but I'm worried that there may be other serious injuries which aren't so obvious. Fracture of his pelvis, an abdominal injury, even a spinal injury.
Do you know where you are right now?
No.
Do you want to hazard a guess? Hospital, correct. And do you know why you came to hospital?
I'm in pain.
Because you're in pain.
What's your name?
Brian.
Good man, Brian. You stay still, I'm going to examine you, okay? Anything sort, just sing out for me, okay? All right, looking at your neck now, okay? Nice big breath in and out. And again, one more time. And out, well done. So pushing your chest now. Is that sore? Is that sore?
Don't nod your head, just say
So
yes, or no.
Yeah. Okay, good man.
The team search every part of Brian's body for any clues to other injuries.
Cool right foot.
Okay, so you're going to get line in, get some bloods off. We're going to get the rest of his clothing off because I wanted to get some x-rays before we do anything else. Right, so chest x-ray, pelvis x-ray, femur x-ray, please.
CT angiogram, yeah?
Yeah, okay, we'll do. The blood flow into his leg is not normal. And what I don't know is whether the artery's been torn or whether it's been compressed or even pinched in between the fracture, or to see what the blood flow is like into that leg. Is there a Doppler around that we can use to have a look at his flow in his foot? His foot isn't a great colour and we can't feel pulse in it, so there's a major concern about whether there's adequate blood getting through below level of the fracture. You know, he could lose his leg if he's not got blood flow into that in the next few hours.
The trauma doctors of the Royal London Hospital and London's Air Ambulance are on call 24/7. Whether it's in the helicopter or the rapid response cars, it's a race to get to patients and unravel the clues that could save lives. trauma doctor Glenn Ryan and paramedic Joe Smith are on their way to a traffic accident in East London.
1,000 metres, right-hand turn onto the A124. We're going to a female patient who apparently has been hit by a truck.
In these cases, the likelihood of serious injury is high. The patient's blood pressure and level of consciousness provide valuable evidence. Any damage to the vehicle increases the chance of internal bleeding, which could be fatal.
We've been running for about 30 minutes, trying to weave our way through the traffic. And this should be our road. Lights up ahead. All right. Okay. Red Base Delta Alpha 77 on scene. Hey guys, how are you?
Aisha, 19-year-old girl.
Okay.
Looks like what's happened is she's run across the road, striking this van. You can see the damage to the front there. The van was going about 30, 35 miles an hour. This car was stationary, so she bounced off of that.
Okay.
It's okay, I'll hold it back.
Hello, sweetie. My name's Glenn. Just open your mouth up for me. Big R. Good on you.
19-year-old care assistant Aisha was on her way home from work when the accident happened. Aisha's father has already arrived.
Going to push on your chest here, sweetie. Any problems with that? Did you bang your head? You got a couple of cuts and bruises on your face, huh? Looking at what damage there's been to the front of that van, I'm concerned that she may have a fracture to her pelvis. I'm also worried that she may have some fractured ribs. And just underlying on that right side is a liver. She may have some bleeding. I want to have a good look at her. Okay. Do you mind if we get her in the back of the ambulance and we'll just get her clothes off and keep her warm? Yeah, lovely. All right. Thanks, guys. Excellent work. All right.
Glenn needs to find out whether or not the car ran over Aisha. If it did, it could make a huge difference to her injuries.
So she sit underneath of your car, has she? She get herself up at all? You haven't gone over the top. All right. No problems. Thanks very much for that. All right, so she's run out and she's hit the headlights. I think it's probably going to be with the right side of her pelvis. There's a little bit of blood on the ground. She's also gone underneath this car here, which was stationary. Injury-wise, I think she's potentially got a fracture to the wing of her pelvis. Certainly got some knee pain. She's got a laceration over her face, but her chest, her abdomen, and the rest of her long limbs are unremarkable at this point in time. Hello there, you're Aisha's dad, are you?
Yes.
You're probably going to be okay to come with us in the front of the ambulance, and she'll go to Royal London. Okay.
With a possible fracture to her pelvis, Aisha could be bleeding into her abdomen. The only way they'll know is to do a CT scan at the hospital.
Royal London, Amy. Okay. Coming by land, yeah? And vitals are stable. Okay, lovely. We'll see you in 10. The leg that's injured must have hit this telephone box. That'll get you out of pain, sir, right?
The foot is very, very pale, and I'm really worried about the blood supply. He's at risk of losing this leg.
Okay.
It's almost an hour since 44-year-old bike courier Brian came off his motorbike. Time is running out if the trauma team are to save his leg.
Okay, so his pelvis X-ray looks fine, his chest X-ray looks fine. My only concern is about the leg.
No. Can't feel anything on the... Can you feel you being touched on the right foot?
No.
No. Okay. How about now?
There's something on my toes,
Yeah.
my left leg.
How about on the right leg?
No.
He could lose his leg if he's not got blood flow into that in the next few hours. The clock's ticking and we've got to find out if that blood flow is adequate or not, and if it's not, restore it before the damage is irreversible. We can't feel a pulse in the foot here, so we're using a Doppler tool to try and find blood flow, which is more sensitive than the fingertip.
But they can't find a pulse with the Doppler machine either. If Simon's going to save Brian's leg, he needs to try something else, quickly.
We're going to try and whack a Donway and see if it will bring it out to length better to improve it, and then get him into CT.
Yeah, manipulate it back.
OK, let's just get the Donway on.
This air-filled splint works by gradually pulling the fractured bones apart and realigning them. Simon's hoping this will help the blood flow back into Brian's foot.
OK, that feels pretty good. OK, lock it there then, please. It should be locked in place. OK, good. Right, let's just go for a CT angio.